A word of warning from the nation's top infectious disease expert, Dr. Anthony Fauci, saying the fight against coronavirus will only get tougher through the fall and winter. He suggests we need to, quote, hunker down for the rest of the year. I know y'all got a lot of questions with this evolving medical guidance, so as we do every Friday, I want to bring in Dr. David Winter from Baylor Scott & White Health. Good morning. Good to see you, Dr. Winter.
Good morning, Sonia. Good to be with you.
So I've already received messages from parents this week saying there's been a case of COVID-19 confirmed at my kid's school, but the school's not shutting down. What is the proper protocol? You know, I said to this mom in particular, look, they're not going to shut down school every time there's a positive or confirmed case. So what should schools be doing when this happens?
Well, Sonia, I agree with you. An isolated case here and there is not a reason to shut down a school. If there is a big outbreak, now that's a political and a governmental question, but that's when they should consider shutting things down. Not an isolated case. Those are going to pop up. We're going to see lots of cases pop up. It's the big clusters. That's what we worry about.
Someone also asked me when it's appropriate to get the flu shot with regard to COVID-19. So say you've had it and then recovered. Does that matter when you should get the flu shot?
No, the COVID virus is totally different from flu, of course, so you can get that shot anytime. Shots are out there now. You definitely should get it before the end of October. We want to get it before the flu season really starts, which usually is January, February. But this year in particular, we cannot handle a huge flu epidemic on top of this COVID epidemic. It'll be a crisis in healthcare ability to take care of those folks. So please get a flu shot this year. Very important.
I would anticipate that people who have children in, sports or athletics want to do that ahead of time because it takes a couple of weeks for that flu shot to kick in, especially since their kids are in such close contact with one another.
Yeah, no question about that. It takes at least 2 weeks for the flu shot to work and 6 weeks for it to be total effect. So you want to get those flu shots early. And again, the flu actually responds to the same thing COVID virus responds to. Distancing. So distance, wear a mask where you can, and disinfect your hands. Those worked for the flu epidemic also.
I also had another question from someone who said, what are the safest ways to visit parents, or grandparents, basically the elder loves in your life? I know that, there are some holidays coming up. People are thinking ahead. How can we travel? Can we trick or treat? All this stuff. So what do you recommend?
The safest way to visit with your grandkids is a virtual visit. Get your phone out or get a computer out and have a virtual visit. Those work pretty well. If you just have to see them, you need to be 6 feet apart at least. You need to wear a mask. You need to disinfect your hands. No hugging, no kissing. That's just no handshaking for the adults. That's gone. We can't do that this year because this virus is still highly contagious. It's out there. It's ready to attack. So the rules can't change. We have to be very careful with this virus.
And Dr. Winter, how close are we to the development of a really good at-home screening test? I mean, we've heard about some of them. What type of access do you think we'll have to them in the coming months? The really reliable ones.
Yeah, that's a very important question, and that's a hot topic right now. The viral swab that goes up your nose, that takes a day or so, sometimes a week to get the results back. So that's slow. They've got some new antigen tests. They don't test for the virus itself, but remnants of the virus. And it's pretty good. Not quite as good as a viral swab, but if you do it repeatedly, we think that's going to be the technique to find where this virus is going. These new antigen tests can be done in 15 minutes. One company says they're going to charge $5. That's quite a good deal. They're just starting to become available. So when those are available, that's going to be something we want to take advantage of because you can get those done quickly and inexpensively. We can track where this virus is going and hopefully arrest the spread of this virus, which is just going to get worse if we don't. This cool weather, like Dr. Fauci said, it's likely to make the virus worse. So please try to distance, try to wear your mask wherever you can, and disinfect your hands.
Yeah, wash your hands. I can't say it enough. All right, Dr. Winter, thank you so much for your time as always.
Thank you, Sonia. Good to see you.